Brucellosis is an infectious disease caused by bacteria of the genus Brucella. It primarily affects animals, particularly livestock such as cattle, goats, sheep, and dogs, but it can also be transmitted to humans. The bacteria are typically spread to humans through unpasteurized dairy products, undercooked meat, or direct contact with infected animals or their fluids. In this video, we will explore the causes, symptoms, diagnosis, treatment, and prevention of brucellosis. Brucella species are small, gram-negative bacteria that can survive within host cells. There are several species of Brucella, with Brucella abortus, Brucella melitensis, and Brucella suis being the most commonly identified in humans. Each species is associated with specific animal hosts. For example, Brucella abortus mainly comes from cattle, Brucella melitensis from goats and sheep, and Brucella suis from pigs. When a person becomes infected with Brucella, the bacteria enter the body, often through the mucous membranes of the digestive tract, respiratory tract, or broken skin. Once inside, they can multiply and spread throughout the body via the bloodstream. The incubation period for brucellosis can range from a few days to several months, depending on the dose of bacteria and the mode of transmission. Symptoms of brucellosis can vary widely among patients. Common early symptoms include fever, chills, night sweats, fatigue, and malaise. As the disease progresses, individuals may experience joint and muscle pain, headaches, and abdominal pain. In some cases, patients can develop more severe complications, such as arthritis, endocarditis, or meningitis. The chronic form of the disease can lead to symptoms persisting for months or even years. To diagnose brucellosis, healthcare providers often rely on a combination of clinical evaluation and laboratory testing. Blood tests are commonly used to detect antibodies against the bacteria. These tests can sometimes yield false negatives early in the infection, so they may be repeated. Culturing the bacteria from blood or bone marrow is the most definitive method but can take time as Brucella grows slowly. It's critical for healthcare providers to consider a patient's history and potential exposure to animals to arrive at a correct diagnosis. Treatment for brucellosis typically involves a course of antibiotics. The most effective combination often includes doxycycline and rifampin for at least 6 weeks to prevent relapse. In some cases, other antibiotics may be used, especially for patients who are pregnant or have specific allergies. Early treatment is crucial, as longer untreated infections can lead to more serious health issues. Preventing brucellosis primarily focuses on controlling the disease in animals and educating the public about risks. Vaccination of livestock is one effective measure to reduce the spread of Brucella. Additionally, promoting safe food handling practices, such as consuming only pasteurized dairy products and thoroughly cooking meats, is essential. For individuals working in close contact with animals, wearing protective gear and following biosafety protocols can help reduce the risk of infection. In conclusion, brucellosis is a significant health concern that poses risks to both animals and humans. By understanding how the disease spreads, recognizing its symptoms, seeking timely diagnosis and treatment, and implementing effective preventive measures, we can work towards controlling and reducing the impact of brucellosis. If you suspect you may have been exposed or are experiencing symptoms, it is essential to consult a healthcare professional promptly. Thank you for watching, and don't forget to subscribe for more educational content on infectious diseases and public health.